Hello, everyone. This is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. Welcome to our Wednesday live stream. So today I'm talking about trust and healthcare. It seems to me that we have some major trust issues in healthcare at this time. And I think there are things that we can talk about and ways that I think it can be helpful to guide individuals. So here at Chicago Arthritis and Regenerative Medicine, we are focused on non-surgical management, evaluation, and treatment for arthritis, tendinitis, injuries, and back pain. So something I think about a lot recently is the idea of trust and obviously how it applies to what we're doing here at work as a healthcare provider. And trust is a huge issue, obviously, in everything in life. Without trust, what do you have? But certainly trust is a major issue in healthcare. We're talking about taking care of people. We're talking about dealing with people's actual health issues, their family members, all of that. And that is, that's a pretty big deal. And I think of this in really two different ways. I think there's trust when it comes to on a micro level and then trust on a macro level. And they're very different issues. On a micro level, we're talking about trust between you and your direct physician, one-on-one. That's a traditional way that medicine is practiced. You trust that one individual from your healthcare standpoint, and they in turn sort of give back by giving you more information, taking care of you like they would your own family member. That sort of trust is essential, and I think that's what makes medicine work for sure. That's a traditional way. That's what really pushes everything through, and trust is really everything in that regard. I think what's interesting is at that level, there are things that get away in trust. There's middlemen, there are insurance companies, administrators, other types of middlemen, and other types of motivations that can get in the way of that. But at that really micro level, if you have trust with your physician, you have a good and reliable relationship to kind of walk you through challenging circumstances. On the other hand, on a macro level, really big picture level, we all kind of lack trust in healthcare. And unfortunately, when you look at who's really driving healthcare issues and topics, and thus trust on that bigger picture level, it ends up being, I think, three groups that are not the most trustworthy or the most reliable. Certainly, unfortunately, right now, we count on politicians for our healthcare decisions right now, which is really crazy if you don't trust your politicians. And the problem is that these clearly are not individuals who are aware of all the healthcare issues. They are more ignorant to the issues. And even if you take politicians at a national level that have been physicians, they haven't been physicians for years or decades. Like they don't know what they don't know. They're not exactly the people you would trust when it comes to your own healthcare, let alone making decisions on a macro level when it comes to public health sometimes. So on the next level, then we have really large organizations like the FDA, the CDC, the WHO, who are meant to be trustworthy, and at times they're trustworthy, but unfortunately at times their motivations are also a little bit off. For example, we've had guidance from the CDC and the WHO when it comes to COVID, but when you really dig through it, when it comes to decision-making from a physician end for patients, it's not always that reliable. As an example. So we've had some patients who've been traveling recently, either internationally or domestically, and are back in Chicago and they need to be treated. And they're calling, asking, can they come into the office? And we actually have some guidelines from the Illinois Department of Health. But when you really dig into it, the guidelines are not definitive. They don't really tell you, yes, you need to do this, or no, you can't do that. And in the end, you end up taking some of those guidelines as a physician and you say, well, what's right for my patient? Let me ask around to some of my colleagues who I really trust. And in the case of a couple of patients recently, we had to actually delay their treatment because they had traveled, and a very trusted infectious disease colleague of mine said, listen, you really need to stick with that 10 to 14-day quarantine period, even if their testing has come back negative when they've returned from their travel. And so, unfortunately, the guidelines that we have at a state level or at a national level are not always consistent. They vary from organization to organization. And in addition, they're not always specific enough to guide us. So we don't have a lot of trust even in those organizations. So then you look at, well, what about medical specialties, right? Like as a physician, you look at your own specialty organizations that stand up for us, that vouch for us. And we have leaders in those organizations. And unfortunately, a lot of these organizations are not really speaking up like they should be. And you wonder, is that because they themselves don't feel confident in their recommendations with something that is relatively new? Or is it because they're driven by other motivations as well? Or because they just don't have the voice that they think that they have, or the confidence that they should have when it comes to guiding those of us at a local level. So it's strange, because while I understand that individuals, the lay public, does not have trust in these kind of organizations, believe it or not, for physicians, we don't trust those organizations either, because their recommendations are either misguided, ignorant, uninformed, or inconsistent, or wishy-washy, and not specific enough. And in the end, it sort of comes down to, at least for me, talking to other physicians who I trust, comparing ideas, sharing ideas, and having to make decisions that we think are correct for individual patients, for their particular situations, that are first and foremost meant to protect people and prevent them from getting into more trouble. So what can you do as an individual at this time? And how do you keep trust during this time of COVID? I think there's a couple things that I would recommend. Number one, be aware of the big picture guidelines that are out there. And again, understanding that these guidelines are not always consistent, but what are the big picture guidelines? Things like, if you're traveling, right? Air travel. Well, yeah, you should isolate when you return. That's just good common sense. If you're coming from areas that are more high risk, then absolutely you should quarantine when you come back. Absolutely, you should be masking up when you're in public, and absolutely you should be avoiding large gatherings, and you should be socially distancing. I think they're common sense things, but oddly enough, not everyone's following that. But those are the guidelines that we have on a national and international level, and I would definitely be aware of that. Number two, you want to have a good, close relationship with your trusted physician, meaning with your physician, you should be able to talk through and figure out what is correct and safe and appropriate when it comes to protecting your own self, your own family, and doing what's right in your own particular situation. If you don't have that kind of trust with a physician, you need to find one to have that, because the role of your physician is to take these kind of complicated, challenging situations and be able to create a set of guidelines for you that are meant to protect you. That's literally what we get trained to do. We get trained to look at situations that are a bit murky and difficult, try to make the best case decision, learn from that, adapt, and then keep on trying to protect individuals. That's what medicine is. It's not a pure and clean science. It is very messy and dirty and confusing sometimes. And our training is meant to help guide you through these kind of times. Next, I think when it comes to risk decisions, and right now, really all of our decisions are based on being very keenly aware of our risk and whether it's worth it or not. I think you need to make smart decisions, but not fearful decisions. And you have to be able to walk that kind of that tightrope. So smart decisions in the sense that, is the risk that you're taking really worth what you're getting, right? And at the same time, not being too afraid for that. So as an example, my own daughter is back in school. That was a challenging decision for my wife and I, because we definitely had concerns about, is this safe or not? But we looked at how her school was evaluating this, how they were thinking through it, what are their plans. And in the end, it made sense to us. In the end, it made sense that while there is some risk there, we thought that their plan was smart, intelligent, and sensible. And we felt appropriate to send her to school. That was a risk-oriented decision, one that we made with a little bit of concern, for sure, but one that in the end, I think was a smart and correct decision for us. And then I think the last thing is, when it comes to going through this period of time, expect problems, right? I mean, as we've seen in this country, that if you don't do things ideally, you're going to have problems. But I think as people start to send their kids back to school, and that's going to happen really throughout the country, if it's not solely already happening over most parts of the country, expect that there are going to be problems. Expect that you're going to hear of outbreaks. Expect to hear that you're going to have schools that have to close again. Here in Chicago, The city and the state have essentially kind of walked back the guidelines when it comes to eating out at restaurants. It used to be you could have X percent, I think 25 or 40% of capacity, and they've now really sort of restricted that much more aggressively because cases have started to increase. I think in this period of time that's so volatile and up and down, you have to expect problems. You have to make smart decisions, but expect that there may still be unknown things that still happen. That's the nature of what this is in terms of a pandemic, in that it's the results and the circumstances are going to change from day to day, and we just have to be prepared for that. And while that's not easy, mentally, if you go into it like that, I think you'll be better off in that you're not going to be making fearful decisions. So trust and healthcare. I think trust is everything in life. I think in healthcare, it's everything. I think we're missing a lot of trust right now in life in general, let's be honest, but I think certainly in healthcare as well. And I think if you have a sensible approach right now, and I think if you have physicians who can partner with you to make smart decisions in your own life, I think you can get through this period. I think you can make sensible decisions, and I think you can still be safe and appropriate. Thank you very much for your time. As a reminder, we do this live stream Mondays and Wednesdays around 12:30 p.m. Central Standard Time. And I'm also doing a webinar today on regenerative medicine treatments for runners. If you'd like to check that out, that's at 4 p.m. today. And until next time, have a good day, be safe, and live well. Bye-bye.